Welcome everyone. I am Dr. Ahmed Elarabi, a demonstrator of medical education at Faculty of Medicine, Mansoura University. Today's presentation is about reflection and reflective practice in medical education. This is an essential skill for both learners and the professionals, and in the next few minutes, we will see why. As you can see on this slide, the objectives of this session are clear. By the end, you should be able to define reflection, understand its significance in learning, differentiate between reflection and feedback, and review some key models such as Gibbs reflective cycle. These are the main points we will cover step by step. What is reflection? Reflection means the critical analysis of one's own experiences to improve future performance. It is not simply describing what happened, but asking why it happened, what went well, what didn't, and what can be done differently next time. The key elements, as written here, are looking back, identifying strengths and weaknesses, and applying insights for growth. In medicine, this is what transforms experience into real learning. This slide shows an important comparison between reflection and feedback. Reflection is a self-directed internal process. It comes from within the learner. But feedback, in contrast, is external input from others, such as tutors, colleagues, or patients. But the two are complementary. Reflection helps us process and make sense of the feedback we receive, and together they support meaningful change in practice. Here you can see Gibbs reflective cycle, a model developed in 1988 that remains one of the most widely used frameworks for reflection. It presents 6 clear steps. On the next slide, we will walk through these steps in detail using the reflection template. This template is built directly on Gibbs reflective cycle, and it gives a structured way to guide reflection. The 6 stages are: 1. Description, what happened. 2. Feelings, what emotions and reactions were involved. 3. Evaluation, what was positive and what was negative. 4. Analysis, why things happened as they did. 5. Conclusion, what else could have been done. And 6. An action plan, how you will act in the future. By following this structure, reflection becomes systematic and truly useful for improving future performance. Now let us apply the cycle to a real clinical example. For example, a trauma patient with Glasgow Coma Scale score 6 needed intubation. The junior doctor attempted twice unsuccessfully before calling for senior help. The delay caused hypoxia and later brain injury. Now, by reflection on this experience, 1. We describe the experience. I failed to secure the airway quickly and delayed escalation. 2. Feelings. I felt panicked during the attempts and guilty afterwards. 3. I evaluate the experience. I acted promptly at first, but repeating attempts wasted valuable time. 4. Analysis. The issue was poor preparation and not following the difficult airway protocol. Conclusion. I realized the importance of preparation, teamwork, and early escalation. And finally, my action plan. In future, I will prepare all airway equipment, limit myself to 1 attempt, and call senior or anesthetic support immediately. This slide shows us both advantages and obstacles of reflection. On the advantages side, reflection enhances self-awareness, helping us understand our own strengths and weaknesses. 2. It promotes continuous learning by encouraging us to build on every experience. 3. It also improves the clinical skills by allowing us to analyze what went well and what didn't. 4. Reflection supports professional development over the long term. And finally, it encourages critical thinking, which is essential in complex clinical situations. But there are also obstacles. A major one is lack of time. In busy clinical practice, it can be hard to pause and reflect. Another one is limited training, because not everyone knows how to reflect effectively. Fear of criticism can also stop learners from being honest in their reflections. Sometimes reflection becomes superficial, just a box-ticking exercise instead of meaningful analysis. And finally, institutional barriers, such as unsupportive environments, can make it hard to practice reflection regularly. The important message here is that while reflection offers many benefits, we need to be aware of these obstacles and work actively to overcome them. This final slide summarizes our discussion. Reflection and reflective practice are powerful tools for professional growth. By using structured models like Gibbs cycle, recognizing both advantages and barriers, and applying practical solutions, we can create a culture of continuous improvement in medical education and clinical work. Now remember, reflection is not just an academic task, it is a habit for lifelong learning. Thank you for your attention. I hope this session has given you a clear understanding of reflection and how to use it in your own learning and practice.